Thanks for joining us today. Welcome to the Center for States video series on implementation planning and capacity building. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Implementation Planning and Capacity Building Brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to planning the implementation of an activity, program, or intervention to address a problem or need, and consider strategies to building agency capacity to implement it. It does this by providing step-by-step guidance to prepare for the implementation, make a plan for addressing any gaps or capitalizing on strengths, and then developing a plan for implementation that includes the actions needed to get ready, actions needed to implement, and actions to measure. Implementation planning and capacity building is broken down into 3 parts and 8 essential functions or steps that may be presented linearly, but they often overlap, and teams will loop back and forth between them. Part 1 is preparation and includes outlining the plan elements, identifying sources, and considering the agency context. And then 2 is revisiting the teaming and leadership structures. Part 2 is planning for capacity building and includes reviewing readiness assessment findings and developing strategies to build capacity and strengthen motivation. And Part 3 is development of the implementation plan, including building a work plan for activities to get the intervention and agency ready prior to implementation, building a work plan to identify the activities that will roll out the intervention and measure the quality and outcomes associated with it, identifying communication and engagement activities, and consolidating and reviewing the plan as needed. In this module, we will look at Step 1 in preparation, outline plan elements, identify sources, and consider the context. Let's get started. Why should teams invest time in outlining the elements of the plan, identifying sources, and considering context? The implementation plan integrates information from various sources, often work that the team or the agency has already done, to tell the story of how implementation of the intervention is intended to go, and to proactively identify the supports and potential challenges to successful implementation. A comprehensive plan will help agency leaders and team members get the big picture view of the various parts of the implementation plan and start working out how to complete them and who will do it. The outline of elements and consideration of context will help teams move the focus on implementation planning as just a work plan to a more comprehensive effort that will support effective implementation. As noted in Module 1, Part 1 of implementation planning and capacity building is preparation. For this first step in preparation, it's important to recognize that the information for plan elements will likely come from work already completed by a change in implementation team, or can be drawn from sources that are already accessible to the team. Let's take a look at some common elements that should be considered when outlining an implementation plan: the background and contextual information, an overview of the selected intervention, and identification of the implementation team, the readiness assessment findings available to the team, work plans for testing and staging as well as final implementation, and plans or early ideas for data collection, evaluation, and CQI, as well as engagement and communication strategies, and any anticipated challenges or barriers to implementation and how the team might address them. Let's take a closer look at the elements, as well as the sources where agencies likely can pull the information from, and some considerations. Background and contextual information. To set the stage for implementation planning, plans typically include a problem statement, theory of change, and description of the target population. Teams should be able to revisit earlier work in the problem exploration and theory of change stages of the change and implementation process. If teams do not have this information, they may need to do some work in these areas before completing the implementation plan. In addition, teams may discuss relevant internal and external context, including timeframes and requirements that may affect implementation decisions. For example, from settlement agreements, statutory deadlines, grant requirements, CFSR PIP timeframes, or other regulations and guidelines. Let's look at 3 more examples of elements, what components might be included, and where teams might find this information. The intervention overview. An important starting point for implementation is the description of the intervention, its purpose, underlying principles, core components, and evidence base. Teams can likely pull this information from their previous work during the process of selection, adaptation, or design of the intervention. Implementation team. The plan should outline who is on the implementation team, their roles, and the teaming structure. This may require revisiting the current teaming structure and team members. This topic will be addressed more in detail in Module 3 in this series. Readiness Assessment. Findings from the prior assessment of organizational readiness will serve as a springboard for developing capacity building strategies that leverage strengths and address identified needs. Teams should look specifically for areas that will be relevant to the implementation efforts in motivation, general capacity, and intervention-specific capacity. Let's take a look at 2 core elements that should be included in an implementation plan, as well as the sources where agencies can likely pull the information from. The work plan. The work plan outlines activities for before and during implementation. As the core of the implementation plan, the work plan lays out how the agency will operationalize the intervention and prepare for rolling it out, including any plans to complete core components of the intervention, develop capacity, test, pilot, or stage an intervention prior to full rollout. More detailed information about how to identify these activities will be discussed further in Modules 7, 8, and 9. Data collection, evaluation, and CQI plans. The implementation plan should provide preliminary thinking on how implementation will be monitored and how data will be used to adjust implementation and make improvements. Subteams may be developing plans for data collection and CQI activities at the same time as the implementation planning. A more thorough discussion of how to identify these activities is in Module 9 of this series, and more detailed information on specific evaluation processes teams may refer to the Change in Implementation and Practice series on monitoring, evaluating, and applying findings. The last 2 areas of common elements include engagement and communication strategies. This section of the plan describes how the team will keep leadership and stakeholders at all levels informed and engaged. These strategies will build on plans developed during earlier teaming activities and will evolve as planning continues. And anticipated challenges and approaches to address them. A proactive plan is able to anticipate potential challenges or barriers and recommend strategies to overcome them. Teams can learn more details about how to identify barriers and address potential strategies to prevent disruption in Modules 11 of this series. As teams begin to pull together the implementation plan, they should think through internal and external factors that may affect implementation and their implications. These may include relevant deadlines and timeframes based on state statutes or policies, federal regulations, annual plans or grant requirements, whether the intervention is a replication, adaptation, or new design, and its existing evidence base, and what that means for testing and gathering feedback. The level of risk to the agency and the target population if the intervention is not implemented well or does not produce expected outcomes. Stakeholder expectations, or other factors that might influence implementation, piloting, staging, and evaluation decisions. Teams should consider the following as they outline the elements, identify sources, and consider context. Think about planning as telling the story of how implementation of a selected program is intended to play out. Consider what internal and external pressures may affect implementation plans and how the team might address them, for example, timeframes, intervention history, and stakeholder expectations. And consider who will be responsible for developing the plan and how stakeholder groups will be involved in the development and review of the plan. It is important to include members of the target population as well as system partners in this process. Let's take a moment to check in on what you've learned about outlining implementation plan elements, identifying sources, and considering context. Why do teams outline plan elements, identify sources, and consider context? To tell the story of implementation, to get a big picture overview of the intervention, and to build a comprehensive plan to support effective implementation. How do teams outline plan elements, identify sources, and consider context? Deciding as a team which elements need to be included and what sources to use, and thinking through the potential factors that might impact implementation. What can help teams outline plan elements, identify sources, and consider context? Telling the story of how implementation is intended, considering the internal and external context that might impact implementation, and clearly defining who will be responsible for and involved in the development of the plan. Now, take this a step further by reviewing the reflection questions for outline implementation plan elements, identify sources, and consider context in your implementation planning and capacity building workbook to connect what you've learned to your own experience. Up next is Revisit Teaming and Leadership Structure, the third module in this series and the second function in implementation planning and capacity building.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P23320140033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.